Hello, and thank you for joining us today. My name is Keith Knabb, and I'm the owner and founder of Affordable Medicare Solutions. We are Georgia's #1 Medicare planning agency. I have myself and 8 employees, and we have been here for 26 years. We have complete experience in all the topics in Medicare, and all of the services we provide are free to you. There are no charge. So let's learn something today about losing employer coverage. This is a major topic when people are past age 65 and have been working and have decided to retire or received a furlough or a layoff notice. And how do they quickly, properly, efficiently get their Medicare started and not create situations that create gaps in coverage or penalties? Today's topics: aging into Medicare is different than being past age 65. Losing employer coverage. How do I obtain my Part A and Part B of Medicare? And what are my next steps after I obtain my basic A and B coverage? So aging into Medicare. The initial enrollment period of aging into Medicare is a 7-month period tied to your birthday month. So you have 3 months prior to your birthday and 3 months after your birthday month for a total of 7 months. Now that time period you can bypass if you are working past age 65. But if not, and you're aging into Medicare and you don't have group health insurance, you do have a choice between either using what we call Medigap traditional insurance plans for Medicare under traditional Medicare, or the new Medicare Advantage programs. So very quickly, Medigap plans typically have no pre-existing condition issues. They're guaranteed to you. They have extremely low or no deductibles, and you pair them with drug coverage that Medicare also offers you. And you can move your plans for the Medigap insurance anytime during the year. The drug programs you can move at the end of the year. So this is traditional side of Medicare, and the new Medicare Advantage programs are different. That's where you do have networks of doctors called HMO or PPO, and they do have other subsets of different types of plans, and they're allowed to offer you additional benefits under the new Medicare Advantage system. Now, there are no pre-existing condition issues with the Advantage system, and you also have rules on what time of the year you can move out of your plans. So that's for somebody who doesn't have group health insurance, and that's some of your friends. But if you're now working past age 65, you have a different situation. If somebody wasn't over age 65, they are easily covered either by COBRA or by the Affordable Care Act plans if you're younger than age 65. So if you have a spouse who's 63 and you're 65, you have different choices. Your spouse might take COBRA for a year or 18 months, while you might go into Medicare. So if you're over your age 65, you're going to activate Medicare, and you're going to use what is called a special election period, which is losing group health insurance coverage. So when you lose employer coverage, you got to activate your full Medicare. Some people, when they're 65 and they decide to keep working, they activate one part of Medicare called Part A, which is the hospital only part of Medicare, hospital coverage. And later on, when you lose the employer coverage, you're going to activate Part B. But if you never got around to activating A, you're going to need to activate both of them, A and B. So you want to create a personal login at Social Security, which is the official government website, ssa.gov. I'm going to show you on the next screen how to do that. But you can't do it if your credit is locked for protection. I lock my credit so that people can't go in and steal my identity. Some people do that. If you have your credit locked, you have to do a temporary unfreeze at the credit agency so that Social Security can verify your identity. And when you do activation for Part B, you can actually do it online. Because of 2020 and the shutdown of so many buildings and offices, they decided to create things on an online basis much easier than before. It took a pandemic to kick them in the pants, but it's very effective. Now you can actually do it online, and it takes 1 to 2 weeks to process, but you're going to need a special form that you have to upload during that process. And that form is called the employer verification form, which gets filled out by your human resources department or just your supervisor at work. It's a simple form. I'll show it to you. But you want to call Social Security to make sure they received it on the upload. Make sure that they have it so that it's not 2 or 3 weeks in and they say, we don't have this form. So you want to call to make sure that they receive it. Typically, it's not a problem, but you want to make sure. This is what it looks like when you go to Social Security. It has an official website, and it says at the top right corner, sign in or up, sign in / up. So you'll click on that button. And you also notice on the front page, it says Medicare enrollment. Well, first you need to sign in and create your account. If you've already done this, instead you'll click on Medicare enrollment. But when you click on sign in or up, it'll say, here's the information that you're going to need. You're going to have a valid email address, your Social Security number, your US mailing address, and have to be at least 18 years of age. And you'll do create new account at the bottom. Now, the employer verification form. This is a form. We can send it to you. I have it. I can email it over to you. But it asks for the employee's name, their Social Security number, all of those things. But the employer has to fill out some other information. How long have you been covered? When is the coverage going to end? The signature of the company official and their title. Make sure all of this is filled out, because the typical error when Social Security sees these forms is there's a spot missed and they tell you got to restart, refill it out, re-upload it. So make sure it's all filled out properly before you upload it. Now, this is the how to obtain that Medicare A, which is your hospital coverage, and Medicare B, which is your outpatient coverage. Part A has a 0 premium for most people. Part B has at least $148.50 of premium, could be more depending on your income. Now, the initial enrollment period. This is when you're turning 65, initial enrollment period. If you're already receiving Social Security early, they're going to send you your Medicare card automatically. If you're not receiving Social Security, you have to actually ask for it. But you don't need to ask for it if you're working with your employer, because your employer coverage will be primary if you have a large employer, 20 or more employees. Now, if you're at a small employer, you have to activate Medicare Part A and Part B. So call me or talk to your human resource department, because Medicare is primary if you're at a small employer. So be really careful about this. Now, the special enrollment period. This is for people who have decided to wait past age 65 to activate either A or A and B. So anytime while you're covered by the group health insurance, you can activate your Medicare. Or if you fail to activate it when you while you're working, you have an 8-month period after your employment ends. But don't mess around with that 8-month period. Just do it prior to your employment ending. So you put in your notice at work, hey, I'm going to quit 60 days out. I decide, I'm going to give you a 2-month notice that I'm leaving. You're going to use the employer verification form, get that filled out by the human resources supervisor. That's kind of letting the cat out of the bag anyway, that you're going to be leaving work, and you're going to submit everything to Medicare. And it's going to take them about a month to get your Medicare activated and your new ID card sent to you. It'll show up in your Social Security account under the message center that they have completed your application and have mailed you your cards. Once you receive your new Medicare ID card, which is a red, white, and blue paper card, that card then allows you to create a Medicare.gov account. And it's really important that you create this account with a login and password. So you can manage your account. You can print your temporary ID cards in case you need an extra one or a replacement. You can see the in-force status of any Medicare plan you sign up for. And this will be where we help you to analyze and select new Medicare plans, such as your drug plan, every fall. So it's really good to have a Social Security login and then your Medicare account login. We can help you store the information on your Medicare account. We don't help you with your Social Security account. Not allowed to. So this is what your Medicare account, when you go to Medicare.gov, the official US government site for Medicare, don't go to other Medicare sites from insurance companies. You go to the official site, you click login and create account. Once you click on that, then at the bottom it says no account, create one now. You create it, and it asks you for this new Medicare number, which is not your Social Security number. It's an 11-digit alphanumeric code that they send to you on your Medicare ID card. Put your last name, your email address, your date of birth, your zip code, and the date that Medicare is going to start, and they allow you to set up your login and password information. So this is what, once you do all of that, while you're waiting for your Medicare and Part A and Part B to be fully awarded, once you've asked for it, we can go in and actually do a Medicare plan review prior to you receiving your Medicare information. So if you have a tight window of 6 weeks or something before you retire, let's get going quickly on pre-planning so that as soon as you're awarded your Medicare number, instantly we can go ahead and do the applications and have you started, so there is no gap in coverage between your employment and Medicare starting. Once you do that also, so you can check with your current doctors to make sure that they're going to accept you under Medicare. Most doctors will continue seeing the patient when you go into Medicare, but some don't. So do make a phone call to your doctor. Check with your dentist, not whether or not your dentist takes Medicare, because Medicare is not covering dental care, but check with your dentist to see if they participate in certain dental insurance programs. If your dentist says, hey, I take all dental plans, don't ask them that. Say, which plans are you an in-network provider? And we'll look at those plans. Be careful on your dental care. But then also schedule your annual review. So once you sign up for Medicare, maybe that's June or July, you also want to go ahead and set up an October or November review appointment to make sure that you're okay for 2022. Once your Part A and Part B has been awarded and we've helped you to do your enrollments into your plans, that's an electronic enrollment through email, very simple. We will then track those enrollments to make sure that they go through without a snag. Make sure you get approved. And then we'll notify you that you've been approved, but the insurance companies and the plans are going to mail you welcome packages. It takes about 2 weeks to receive that, depending on the US mail these days. And temporary ID cards can be issued in case the mail is too late. My staff can get you temporary ID cards so you can show your doctor and your pharmacy, hey, I am covered, here's my coverage. So our website is very effective and it's got a lot of information there. We have educational flyers on many subjects and also the forms that you'll need in order to build your files at my agency. Very simple. We need your information such as your doctors and your drugs and some other permission slips to do this work for you for free. At our website, the Education Center is very effective, as well as our YouTube channel. So go to www.amsplans.com for even more information. Thank you very much for joining us today. I hope you learned something new, and this was very effective information for you, but just call us if anything was confusing. 770-945-5261. Now, please visit our YouTube channel for other information on how to manage your Medicare. Thank you very much. Have a great day.